Good evening. My name is Destiny, and I will be your conference operator today. Please allow me to welcome everyone to the miraDry webinar titled, Don't Sweat the Prevalence of the Excessive Sweater. At this time, all phone lines will be muted to avoid disruption from any background noise. Time has allocated after the presentation for a Q&A session with our speakers. You may also submit your questions in writing throughout the presentation by typing them in the chat box in the lower right corner of your screen. We will try to answer all questions submitted during the Q&A session. Please note a brief video will be played midway through the presentation. Audio will not transmit through the phone line, so please make sure your computer audio is turned up. Finally, if you experience any technical difficulties during today's webinar, please press *0 and an operator will assist you promptly. I would now like to turn the conference over to Dr. Carolyn Jacob, Associate Clinical Director in the Department of Dermatology at Northwestern University Feinberg School of Medicine. Dr. Jacob, you may begin your presentation.
Thank you, and welcome everyone tonight to this program on miraDry and the prevalence of the excessive sweater. A little disclosure to make: this program is being sponsored by Miramar Labs, and I am speaking on behalf of Miramar Labs, and the product-related information contained in this presentation is consistent with the approved information for miraDry. Our agenda tonight, we're going to go over the definition of hyperhidrosis, and there's a couple different definitions. We're going to talk a little bit about the market need and the prevalence of hyperhidrosis, a little bit about the compelling reasons to address the problem, the current treatment options that we have, the miraDry treatment and the clinical results from that treatment, and then a little bit about my own personal experience using the device on patients in my clinic. And then we'll have time at the end for some questions and answers, so please keep that in mind and ask any questions you like when we're done. So there's a couple different definitions of hyperhidrosis, and one of the definitions is that it's characterized by abnormal perspiration beyond that which is required to regulate the body. The underarm sweat, as we know, is produced through two types of sweat glands. The eccrine glands produce a clear, odorless fluid, whereas the apocrine glands create a thicker fluid with a more distinctive odor. For people with axillary hyperhidrosis, these glands are overactive. They're frequently activated when they should be at rest, and they produce significantly more sweat than is required to cool the body. Here's a little diagram showing you the anatomy of the axillary sweat glands. You can see that there's a hair duct to which the apocrine gland, which creates the odor, is attached. However, the eccrine glands have their own attachment to the epidermis and to the outside world, but they're both located in the dermal-hypodermal interface, which is in the subdermal fat. Now, the International Hyperhidrosis Society criteria for hyperhidrosis uses a little less formal approach. They basically look at the patient's quality of life, and they ask them about their hyperhidrosis disease severity. And they have a scale for this, and it goes anywhere from a 1, which my sweating is never noticeable, to a 2, that it's tolerable but sometimes interferes with my daily activities. 3 means that it's barely tolerable and frequently interferes. And 4 means it's intolerable and always interferes. They also have a way to evaluate physical discomfort in terms of constant wetness under the arms that can lead to bacterial or fungal issues. Some patients have severe odor, such as which is termed bromhidrosis. And then yet other people have destruction of clothing due to the use of antiperspirants and the like. Some other diagnostic criteria, there was one created from the formal consensus group. They were a multi-specialty working group on the recognition, diagnosis, and treatment of primary focal hyperhidrosis. And this was printed in the Journal of the American Academy of Dermatology in 2004. And their diagnosis stated that this needs to be occurring for 6 months, and you need to have 2 of the following 6 criteria. One is that it's bilateral and symmetric. One is that it impairs daily activities. Another is that you have more than 1 episode of hyperhidrosis per week. Another is that this starts occurring at under 25 years of age. The 5th talks about if there's a family history of hyperhidrosis. And the 6th is that the hyperhidrosis ceases when the patient is asleep. In a recent registry of 122 patients that were treated for axillary hyperhidrosis, due to this study that was done by the best clinical practices physicians, and we'll get to that later in the lecture. 57% of the patients treated indicated that they had been previously diagnosed with axillary hyperhidrosis. However, 93% of the patients treated met the criteria that's shown on this list. So that shows us that there were many, many patients who had not been formally diagnosed with axillary hyperhidrosis but actually qualify as people with clinically diagnosed axillary hyperhidrosis. So the Miramar Labs decided to commission some market research to understand the hyperhidrosis landscape, and they hired the Ipsos Vantos Group, which is a leading global research firm, and they've done serving lots of companies, including Johnson & Johnson, Coca-Cola, and Google, so they're kind of a big deal. And what they were looking at when they did their research from 2009 to 2010 was the potential market for a device designed to treat hyperhidrosis, and also is there potential outside the target group of patients who are diagnosed with axillary hyperhidrosis. They also wondered what the price sensitivity would be for these patients, how much would they be willing to pay for the procedure, and then again, how the target group themselves, how substantial are the various target patient groups, and which types of patients would be most accepting of the new treatment. And they looked at patients, and they were invited to participate in an online survey regarding the miraDry system. And there were four main groups. There was the general population they looked at to begin with, which was 18 to 54-year-old people. And then there was a group of them who were hyperhidrosis patients who had been diagnosed already by a doctor as having hyperhidrosis of the underarm. Another group was a group of people that had at least 2 cosmetic procedures at a dermatologist's office in the past 12 months. And then yet another group was considered sweat bothered. They indicated that their sweat was a severe problem and extremely embarrassing. And the Ipsos Vantos group looked at over 3,000 people. And what they found is that 21% of this population suffers from excessive underarm sweat. This breaks down to the fact that 4% of the population has actually been diagnosed by a physician with axillary hyperhidrosis, and that's shown in the pie chart as the light blue or gray area. But an additional 17% of these people polled considered themselves sweat-bothered. 7% of these people were sweat-bothered aesthetic frequent flyers. That's shown in the bright green area. And then another 10% are sweat-bothered, but not aesthetic frequent flyers, and that's shown in the dark green area. So, again, a total of 21% of the population here suffers from excessive underarm sweat. When they broke this down, they also asked the people that were polled, how many events of sweating excessively are you having per week? And the left-hand column just breaks down what I had already told you about the 4% who had clinical hyperhidrosis, and they said that they had about 10 episodes a week of excessive sweating. When the 17% who said that they were sweat-bothered were polled, they also said they had 10 events per week. So clearly there's a large group of people out here who have the diagnosis of axillary hyperhidrosis. They just haven't been to the dermatologist's office for us to tell them, yes, you have the criteria that fulfills you as being someone who suffers from axillary hyperhidrosis. When looking at the same 21% of the patients polled, they asked them if it interfered with their daily activity. And again, the clinically diagnosed patients, of course, 88% of them said that it interfered with their daily activity. But if you looked at these other 17% sweat-bothered patients, they also had the same amount, 89% of them said that it interfered with their daily activity. Again, showing that these patients are not, should be diagnosed as having axillary hyperhidrosis. They just haven't been to the doctor's office yet, but they meet all the clinical criteria for axillary hyperhidrosis. So they also did a screening of 150,000 households, asking them about hyperhidrosis, and found that the people who had the hyperhidrosis, the most common locations they had it in were the underarms, the palms of the hands, the feet, and the face. However, 50% of those with hyperhidrosis have axillary hyperhidrosis. So you've got half of them that are involved here. The prevalence for the men versus women was almost equal. However, the females were much more likely to seek treatment. The average age of these patients polled was 40 years, and the average age of onset was 25 years. So obviously it's affecting this prime working age group population. If you're having this start before age 25, and most of us are going to be working, well, forever at this point, you notice that these people really have to go to work. They have to dress up. This can be a real problem if it's interfering daily with their lives. However, of these people interviewed, only 38% of them had discussed their sweating problem with a healthcare professional. And again, there's probably several reasons for that, and we'll get to that in a second. One of the issues, obviously, that they said was that if they could reduce their underarm sweating, it would reduce their body odor. And the underarm sweating makes them very embarrassed and keeps them from getting physically close to other people. They were also saying that they worried frequently about their underarm sweating and that it had a negative impact on their daily life. And a lot of them said that the sweating was always on their mind, and this was from the Ipsos study that was recently done. Now, the impact of underarm sweating, it shows you here in a poll taken by Ipsos that more people are embarrassed by underarm sweat than by bad breath or by acne, which we know acne is much more prevalent. 80% of the population has had some form of acne in their lifetime, but it's less bothersome than it is to have underarm sweat. So these patients stated that they're very motivated to invest in a solution to their hyperhidrosis problem that's obviously affecting them very deeply. But they tend to suffer in silence because they're embarrassed by their underarm sweat. There's other research that showed the Dermatologic Life Quality Index baseline scores, and they compared that from axillary hyperhidrosis to other common dermatological conditions such as atopic dermatitis, psoriasis, and acne vulgaris. And as you can see, the axillary hyperhidrosis, has the same impact as psoriasis did. The mean score was 10.45, which is showing that it's between a moderate and very large effect on their quality of life. And it was more, again, than acne. They also found in another study that underarm sweat is more embarrassing to people than being overweight, having acne, having cold sores, or having dandruff. According to the Ipsos study, patients were polled and they said that if they could manage their underarm sweat, it would change their lives in so much that they would not be so nervous. They could wear what they want. They could get closer to others. They would have more self-confidence, and their overall life would be better. And the blue bar here is the poll of people who were clinically diagnosed by a physician already of having axillary hyperhidrosis. The green bar is from the patients who said they were sweat bothered, but as we've already discussed, they fit the criteria for axillary hyperhidrosis for being diagnosed with it. So what are our treatment options for our patients? I mean, we have a wide array of treatment options, but for axillary hyperhidrosis, we have 4 that we've currently been using in practice for years. One of them, obviously, is prescription antiperspirants. The efficacy is fair to poor. It requires either daily or every other day use, but can sometimes cause irritation in the area, causing patients to stop using it. It's a non-invasive treatment, and obviously there's no downtime, but can also ruin clothing because the aluminum chloride can bleach fabric. One can also do botulinum toxin, which is very effective, but it only lasts for about 6.7 months, and it does require some injections into the underarms. There's no downtime with this treatment, but it, again, is something that has to be repeated for the efficacy to be maintained. Patients could also look into getting surgery done, and there's 2 main surgeries, either liposuction of the axillary vault or the endoscopic thoracic sympathectomy treatment. The efficacy is kind of technique dependent because the liposuction is done. There's a gentleman out in Germany, Gerhard Sattler, who does a good job of describing how to do liposuction of the axillary vault, but they have to use a special cannula. You have to rasp the underside of the dermis and remove the fat in that area to try to remove the sweat glands, and it's really technique dependent. Some people get good relief from it, some people do not. The ETS surgery, as you well know, is lasting. They go in and clamp the sympathetic nerves. But the problem is that the vast majority of people who have ETS end up having compensatory hyperhidrosis below the level of T4. And that seems to bother people even more than their original problem. These are obviously invasive because they require some surgery and they require some downtime. And they may have some extended recovery from the liposuction treatment with the use of some compressive bandages. We can also give our patients systemic anticholinergics. The efficacy hasn't quite been established. The dosing depends on the patient's response to them, so it's very variable. We have some people that take the medication every other day, and we have some people who take 3 pills twice a day. So it's hard to predict, and we don't have a lot of efficacy information about it. It is non-invasive, and there's no downtime, but again, you're taking a daily medication that might be contraindicated with other medications as well. And now, finally, we have a new procedure known as the miraDry procedure. It's effective. It's a very lasting treatment, and it's non-invasive using only local anesthetic. There's very little downtime, and I'll get into the details about what patients should expect when I get to the end of the lecture. So what is the miraDry procedure? Well, the miraDry is an FDA-indicated device for use in the treatment of primary axillary hyperhidrosis, and this is a picture of what the device looks like. There's a screen, a touch screen, and there's a handpiece that is used to do the actual treatment. Where does this live? It's a microwave technology, and microwaves live in the spectrum between lasers, which are mainly infrared and visible light, and radio frequency, which is higher up in the radio waves. The actual frequency of the miraDry system is 5,800 megahertz. So how does this microwave thermolysis work? Well, microwave energy is absorbed by molecules that are electric dipoles. And these dipoles rotate back and forth as they try to align themselves with the alternating field of microwaves. The rapid molecular rotation generates frictional heat, and then when the temperatures in the target tissue reach a critical level, the cellular thermolysis occurs. We're going to show you a little video here on how this device works.
Microwave energy is perfectly suited to address hyperhidrosis because it can penetrate to the dermal fat interface where sweat glands reside. No other system can preferentially attack this specific interface. Microwave electromagnetic energy is delivered via a handpiece applied in a repeating pattern customized to fit the size of the axilla. When the miraDry system is activated, a vacuum suction separates the target tissue from underlying structures. The miraDry system transmits microwave energy into the skin and seeks the dermal fat interface. This is the result of the unique device design. Due to the microwave frequency chosen, unique device design, and the electromagnetic properties of skin and fat, constructive interference occurs and creates a focal energy zone at the interface. This happens independent of skin thickness. Most other devices cannot create the peak energy zone at that location within the skin. In parallel, a continuous hydroceramic cooling system protects the dermis while heat continues to spread down into the region where sweat glands reside, resulting in cellular thermolysis. Sweat glands do not regenerate, so once destroyed, results are lasting.
So this is just a picture showing us histology of a normal sweat gland, which shows a baseline sweat gland, and then 11 days post-treatment with the miraDry treatment, that the sweat glands are devoid of any nuclei, and there's complete cellular necrosis. And then 6 months post-treatment, the biopsy shows also that there's no regeneration of the sweat glands. And in a study by Dr. Lee and Dr. Zhu, they showed that the ontogenesis of sweat glands is only at the embryonic period. So no new sweat glands are going to be regenerated after birth, making this treatment lasting. So the consumer's reasons for considering the miraDry treatment during the poll from Ipsos were that if this device could reduce their amount of sweat by 75%, they would consider it, that the results take effect virtually immediately, that it was non-invasive, and that it gave lasting results. The procedure for the miraDry treatment takes about 60 to 75 minutes, depending on the size of the treatment area. And what we mean by that is that there's actually different sizes of axillary vaults. So people with a larger axillary vault, let's pretend it's a 6'5" gentleman as opposed to a 5'1" woman, they're going to take a little bit more time to do the treatment. It's recommended that they have 2 procedures spaced 3 months apart for the best results and duration. And this is just a little diagram showing you that you would mark the axillary vault here first, and then the local anesthetic is administered, and then the patient is treated with the miraDry system. So the investigational device was used in 7 different sites across the United States. There was also a data safety monitoring board, and this was to give the device its FDA approval, or clearance, excuse me. They had 120 patients, and 81 of them were treated and 39 were considered controls. For this original study, with the investigational version of the device, they have 12-month follow-up information that we will show you. And the result from the randomized study was that 89% of the treatment group shifted on hyperhidrosis scores from 3 or 4 to 2 or 1. It showed that they had stable efficacy up to 12 months. There were no serious adverse events. There was one adverse event of a little bit of paresthesias that remained at the study exit. And the FDA cleared the device for use in January of 2011. They then conducted an efficacy and duration study with the second generation or improved commercial device. This was done in Canada with Drs. Hong and Dr. Lupin. It was a single-leg, open-label study with 31 patients involved. The follow-up is planned for 12 months, and we can show you today the 6-month data. They looked at multiple efficacy measures, such as the Hyperhidrosis Disease Severity Score. They did gravimetric testing. They asked patients about their satisfaction, and they had them fill out the Dermatology Life Quality Index scoring. The 12-month data from this efficacy duration study is going to be presented in a couple of weeks at the American Society for Laser Medicine and Surgery meeting in Kissimmee, Florida. And what they found in their study is that about 90% of patients had their HDSS score drop from a 3 or 4 to a 1 or 2. And that's what the blue bar is showing you at time points 1 month, 3 months, and 6 months after the set of 2 treatments. And as you can see, that hasn't changed at all over the course of 6 months. The percentage of people who had more than a 50% drop in the gravimetric readings were also approximately 90 to 92% at 1 month, 3 months, and 6 months. And the patient satisfaction was also between 90 and 93% at 1, 3, and 6 months. And the average sweat reduction for these patients that were treated was 82% in this study. And this is just showing you the patient numbers where the vast majority of them were above 80%, with a couple of outliers. The side effects during this study were transient, and exceptions were some mild axillary hair loss, which might be a bonus for your female patients, and one subject with skin irritation. 88% of the events were rated as mild in severity and did not affect the subject's daily activities. 39% or 12 subjects said that they had a little bit of altered sensation in the area of treatment on the underside of the arm, which makes sense. 8 of them had a little bit of swelling in the arm or the chest area. A couple of them had a little bit of a rash or irritation, and a couple of them also complained of soreness. So this graph is showing us the efficacy results, and the top bar, which is the green one, is from the information from the Canadian Efficacy and Duration Study, again taking it out to 6 months, with an efficacy of up to 90 to 94%. The blue bar is showing you from the randomized study that was done with the original investigation device, and their 12-month results showed a 69% efficacy. But again, we'll have the 12-month results from that green bar study here in a couple of weeks, and we're really excited to hear about all of it. And again, that's a second-generation device. This is just an iodine starch test of a patient. On the left, it shows that they have active sweating, and that's where the iodine turns dark. And the 12-month follow-up on the same underarm, the same patient, showed that there was very few active sweat glands after 2 treatment sessions. And that's a year after these 2 treatment sessions. So can you imagine what that would be like to go from that much sweating to almost none? So overall, the miraDry procedure is a lasting solution for excessive underarm sweating. As we've seen, there's an 86% average sweat reduction, a 90% patient satisfaction, a 90% clinical efficacy, a strong safety profile with little or no downtime, and it's non-invasive in terms of requiring any surgery, cuts, or bandages. So we're going to talk a little bit about the experience we've had in my clinic with using the device. Last year, we participated in the Best Practices program, and we started the treatments in April, and the first treatment was in the month of April. The second treatment was in the month of, it was in April to May, it was in May. And the second treatment was 3 months later in August. Our objectives during this study was to confirm the treatment protocol to see if there was any tweaks that needed to be made, to provide feedback on the commercial use of the newer device, and on the procedure in terms of our patient feedback. We tracked the initial group of 20 patients that we did at our clinic. There were 7 other clinics involved in this Best Practices program as well. In our clinic, 80% of the people being treated were female. The average age was 30, but we have a kind of a younger patient population. I'm in downtown Chicago, and it tends to be that we see all the young people. And Google is in my building, so maybe it's got something to do with that. Who knows? But of these patients, 75% of them experienced more than 5 sweat outbreaks per week, and 80% of them had a hyperhidrosis disease severity score of 3 or 4 prior to the treatment with the miraDry device. We followed the subjects with an online survey, and 75% of our subjects completed both treatments. The first treatment for patients took a little bit longer than the second treatment, but it was around 90 minutes or so. The treatments were very straightforward to administer. My PAs actually did the measuring, the anesthetic, and the actual treatments, so they did a wonderful job. The patients tolerated the treatments very well because once they're numbed up, they don't feel anything. And the key that we found for the patients in trying to get them to understand how the device is going to work was to set expectations for them. We also set the expectation that you need to have the second procedure. It's part of your treatment. It's not really meant to be an option. We want you to have 2 treatments 3 months apart for the best results. So these are just some efficacy results. The dark blue line is the baseline sweat distribution on the hyperhidrosis disease severity score. And again, most people were a 3 or 4, and after the treatments, everyone was a 1 or 2. So they had either gone from a 4 to a 2 or a 3 to a 1 of the 18 patients who completed the follow-up survey. And the follow-up from this was about 5 months after the last treatment. We also asked them how many sweat outbreaks have you had in the last week. Again, at baseline, you can see the blue bars showing you that most people had more than 5 outbreaks a week, and post-treatment, most of them had none. A few still had a little bit of sweating, but most of them had no sweat outbreaks. So what was the recovery like and the safety? Well, patients are going to have some swelling after this treatment. However, we manage it quite easily with using ice packs that they are told to use several times a day for 3 days. They also are to take some ibuprofen prior to the treatment and then as needed with food for 3 days afterwards. We try to schedule them away from any big events where they would have to be wearing a sleeveless outfit just on the offhand chance they got any visible swelling in the chest area or the underarm area. We also ask them to not play any sports so that they're resting their arms for the recovery time of about 3 days. Once my staff had more experience, it was kind of easier to set the expectations for the patients. They felt more comfortable with the recovery. And once the patients had 1 treatment, then they knew what to expect, and the second one was a real easy slam dunk for the patients. One of my patients did develop an abscess, and it's interesting, but she didn't let us know that after the treatment she was going on a 2-week motorcycle trip through Napa Valley, and she came back about a week after that with some swelling under her arm. So it was about 3 or 4 weeks after the treatment, but she had swelling under one of her arms and developed a tiny little round abscess that was cultured negative and healed up with a slight scar. And she declined doing the second treatment, but now actually wants to come back and pay for the second treatment. We don't know for sure, but we think it may have been due to the vibration from holding onto a motorcycle after the treatment. That's probably a little too much exercise. So again, we caution our patients for about 3 days to not exercise and not ride motorcycles now. The overall satisfaction from our patients, at 16 out of the 18 were very satisfied or somewhat satisfied with the procedure. And currently in my office, we are doing about, I think we're now up to about 13 or 14 patients a month that we're treating. We've had the device only since the very end of December, so we're only going on month number 4 now, I guess we're starting. But we haven't had a single problem. Patients are doing great, and again, I think setting the expectations and knowing what to expect and how to manage the post-operative, the post-treatment, care has really made a difference for our patients. We're just not seeing any problems whatsoever. So in summary, the miraDry has been successfully added as a treatment solution for patients who sweat excessively in the underarms. And again, 80% of the patients that we treated have right now have not been previously seen by my practice, so they're finding us. They're finding us because of hyperhidrosis. They may not necessarily have solely axillary hyperhidrosis, but we have them come in for a consultation. And of the patients, of these new patients coming in for a sweating issue, about 50% of them are signing up for the treatment with the miraDry. We've had a little bit of PR because when we were doing the best practices clinical trial last May, it was on the news. And we also have had some real luck, I think, because of Google AdWords, print advertising, social media, some community outreach that we've done recently with the Chicagoland Chamber of Commerce exchange event. It was really quite fun because everybody's like, wait a minute, what's this sweating thing about? And they'd come up to us, and because we had a banner that said we have a way to treat your sweating, they'd come up to us and they'd say, well, I have this friend. And I'm still not sure how many of them were just saying that because they were too embarrassed to say it was their issue. But you would be amazed as to how many people have sweating issues if you just put it out there and ask and tell them you've got a treatment for it. We also had an open house and talked about the device as well. So it's been a real great addition to our practice, and we have very thankful patients to know that there's something that they can do that's lasting for their primary axillary hyperhidrosis. So now we have some time for some questions and answers.
This time, I would like to remind everyone that all phone lines will continue to be muted. You may submit questions via the chat box in the lower right-hand corner of your screen, and the moderator will read your question aloud. Please go ahead.
Thank you, Dr. Jacob. There are some questions coming in, so I'm going to get started.
Okay.
First, how many patients are you treating that are truly hyperhidrosis patients versus those that are just sweat bothered?
Well, it's interesting. People are coming to us because they're complaining of sweating, but they may not know what the name of it is. When they come to our office and we ask them the questions, anybody in your family have this? How old were you when this started? It's almost always bilateral, although I do have one human being who has unilateral axillary hyperhidrosis who wants to get the treatment done on just the one axilla. When we talk to them about all the criteria questions that the consensus group had put together, all of them fit into the diagnosis of axillary hyperhidrosis. But they may not know the name for it. They just see there's something that treats sweat.
Okay, great. We've had a question come in about the cost to the patients for each treatment.
Sure. So currently we charge $1,500 per treatment, and we let them know that the total cost is going to be $3,000 because they're going to need 2 treatments. I believe some places may be charging $2,000 per treatment. They can get away with that in the East and the West Coast a little bit more than we can in Chicago. But it seems to be that $1,500 to $2,000 price point doesn't seem to bother people. And these are 30-year-olds. These aren't, retired people who have a lot of savings. They're people that are full-time working, but this is such an important thing for them to have treated that amount of money is no big deal if it's going to give them lasting results.
Okay, great. Another question has come in. It's a three-part question. First, how many patients are you treating on a monthly basis with miraDry? How are you finding these patients? And what percentage of them are new to your practice versus those that are existing patients?
Sure. So, again, we got the device at the end of December, and we've been seeing, in terms of diagnosing, probably, my PAs do a lot of the consultations too, but I think we see about 60 patients a month with the diagnosis of hyperhidrosis coming to us to find out what treatments are available. And then of the patients that come in, most of them who have the axillary hyperhidrosis alone are signing up for the treatment, and we're currently treating between 10 and 13 patients a month. But the ball's going to get rolling because people come in for the consultation. They may be scheduling to have their treatment done, next month when they've got time off and that sort of thing, because you have to come in for an hour, and sometimes people need to do that when they've got some time off from work. And we're finding the patients again. They're finding us. I haven't done anything except do Google AdWords and choose some URLs that work and put it in our Facebook stuff and some of our print ads.
Okay. Another question here on the microwave energy as it's delivered. Is the energy only absorbed by the sweat glands?
It's really absorbed by the area at the interface of the dermis and the subcutaneous fat. So that's why we think that some people might lose a little bit of underarm hairs because the hair follicle descends down into the fat at the junction of the dermis and the fat area. So it's going to be kind of that whole line of area right underneath the dermis.
Okay. Next question. Have you seen any compensatory sweating with your patients?
No. And let me go back to that last question. Because you need the electric dipoles to be absorbing the microwave energy, it's kind of more selective to the apocrine glands and the eccrine glands, but since the apocrine glands are close to the hair follicles, they may end up heating up some of those hair follicles, and that might be the reason for the hair loss. And then, no, the compensatory hyperhidrosis does not happen with this device, which is wonderful because, again, as I mentioned, if you had the ETS surgery, a lot of those patients end up with compensatory hyperhidrosis that's worse than the hyperhidrosis they had to begin with, but you do not see that with the miraDry procedure.
Okay, thank you. Here's a question. Does the LA need to infiltrate the entire axilla? What percentage lidocaine is required, or do you need longer-acting LA?
So we use lidocaine, and we use half and half with epinephrine and without epinephrine. It depends on how big their axillary vault is. Some people need like 12 cc's, and some people need up to 20 or 21 cc's in each axilla. So that's why we do half epinephrine, half plain. And what was the other part of the question?
Let's see.
Let me see if I can scroll up here.
Do you need longer-acting LA?
No, we do need to infiltrate the entire area of treatment. So we mark that out with the grid and numb all of that area up so that they're not feeling any of the microwave energy. And we don't need anything that's longer acting. We numb up one axilla and treat it. And then while they're getting the one treatment done, I usually have another assistant numbing up the other underarm. And then they can go and treat the other underarm.
Okay. How do you measure your patient's sweat reduction, i.e. HDSS or starch iodine?
We don't do any of the starch iodine tests unless somebody wants us to. We basically measure it by feedback from the patient. they let us know. They're very, very honest, and they're going to let you know if they're going to have any sweating that recurs. Now, one of the important things to know is that they've got to have the 2 treatments, because if they only have 1 treatment, they may have a little bit of temporary decrease in their sweating because of possibly some swelling, et cetera, or some inflammation. But then if it starts to ramp up again, that's normal for the first treatment. That's why we have 2 treatments 3 months apart. So we're used to hearing patients, and we tell patients, expect that you may still have some sweating after the first one, because otherwise we would only recommend 1 treatment.
Okay, thank you. Another question. There's a lot of questions, so this is good.
No worries.
What would you say if a patient noticed immediate reduction with sweat after treatment for about 4 weeks, but after sweat has come back more than prior to treatment?
So what that is, what I believe that is that you gave the patient 1 month without hyperhidrosis. They've forgotten how horrible it is. And when it comes back, their perception of how bad it is going to feel like it's worse, because they had that month respite where they weren't having the severe sweating. So it'd be really hard. I mean, you'd have to prove it by doing gravimetric testing. But there isn't a possible way to make them sweat more if you've done a treatment that is destroying the sweat glands. But again, that 1 month time where they've had some respite could be just from a little bit of inflammation, and that again is why we have them do the second treatment at 3 months.
Thank you. Question about the second procedure. Is it really necessary, and why did you say that the first treatment actually takes longer than the second?
Sure. The first treatment always takes longer because we've already done the consultation, but we also have to go through the consent forms. We have to mark out and figure out what size their underarms are based on the templates. We have to mark it out. You have to kind of do a little talk anesthesia to walk them through the whole process the first time. Second time, they know what to expect. They come in, they get the anesthesia done, you get the treatment done, and they're, out the door with some ice packs. So it's more about the re-explaining exactly how the treatment's going to go and having them do the consent forms and kind of walking them through everything.
Okay, thank you. Could you tell us a little bit more about what your patients are telling you about their experience with miraDry and how satisfied they are with their results?
Sure. So when we did the best clinical practices trial last year, it was interesting. I had heard about the device in February of 2011, and I happened to have lunch with like 7 of my girlfriends from college. And, so I've known them for a very long time. I won't tell you how long, but it's been a long time. And they're like, oh, my gosh, you have what? You have a device that's going to stop underarm sweating? And 2 of the 7 had severe underarm sweating that they didn't have when we were in college. And they never bothered to tell me, their friend, that they had a problem with underarm sweating. And, it was just funny because one of the gals was even in my wedding, and when she gave a wedding shower for me, she was sweating so profusely. It was at her house, luckily, that she stuck paper towels under her arms, and she's just a really funny person. She's just making light of it, but her whole dress was just soaked under the arms. So anyway, I told her and my other friend, I said, you have to get this treatment done, and so they both did, and they are so thrilled. When the one gal, Mindy, came back to see me for another reason, she had gotten off the Metra and basically kind of speed walked from the Metra station in the Loop in Chicago to my office, which is, a good 10 city blocks, and got here, and she's like, check it out. I'm not even sweating at all. This is awesome. So I think that, again, because it's interfering with their daily lives, if you can do anything to improve it or eliminate it, they're just absolutely thrilled.
Okay, thank you. A question just came in. Can we use EMLA cream instead of injection?
No. Unfortunately, the FDA-approved treatment protocol requires the injection of lidocaine. The EMLA won't penetrate deeply enough to numb up the dermal sub-Q interface.
Okay, thank you. A few of the slides discuss the side effects, and one of the questions has come in. Could you tell us a little bit more about some of the side effects that you're actually seeing in your clinic?
Well, other than the patient who had that small abscess that then healed, we haven't been seeing any side effects other than what we expect, which is swelling for about 3 days and a little bit of discomfort for about 3 days. We haven't had anybody complaining of any paresthesias or anything else. It could be expected to get a few paresthesias whereby the area was numb. We expect it to be a little numb right after the treatment just because of the swelling, but nothing that's been lasting at all.
Okay, thank you. Another question. How long does the sweat reduction last following the 2 treatments?
Well, as we saw in the lecture, the sweat glands are eliminated and they cannot be regenerated, so the results are going to be lasting.
Okay, depending upon the side effects that are mentioned to you, what's the suggestion to resolve the situation?
You know what? If they're having swelling, it's more icing. If they're having discomfort, it's ibuprofen and icing. If they have any paresthesias, they've all gone away in the clinical trials that have been done previously. So just, encouragement, a little hand-holding if you need to.
Great. Thank you so much, Dr. Jacob. I think that's probably it for questions. We had quite a few, and it doesn't look like I've got any more coming into the chat.
Well, great. Well, I appreciate all of you and your wonderful questions and all of you sticking around after work to listen to this. If you have any further questions about the device, you can feel free to contact your miraDry representative, or if you'd like to contact me, I'm happy to talk to any of you if you come up with other questions later. Thanks so much for joining us.